Hi everyone, welcome to my YouTube channel. My name is Sarah Hornsby and I do something called myofunctional therapy, and I make videos about myofunctional therapy all the time, so check out my channel to learn more. Today I want to talk about something that comes up a lot in my field that I think it's kind of a confusing topic, and that is how do we help kids who are under age 4 or age 5? How do we help them with myofunctional therapy? It's a really challenging age because kids who are 2, 3, 4 years old, they can't do exercises the same way that an adult would do exercises, or that an older child would do exercises to help their tongue and lips and nasal breathing. So what do? Well, I have something called a mini myo program that I talk about a lot with my patients, that I talk about a lot when I teach and when I speak. But basically, with kids under a certain age where they can't really do a lot, this is where the parents really have to step in. And this is hard, okay? It's really hard because how do you tell a 2-year-old that they need to close their mouth and breathe through their nose? So there's very simple exercises that you can do, but a lot of it in my practice is guiding parents to the right people. So if I see a 3-year-old who's mouth breathing, I know that they might have some underlying issue. I have to ask, what's causing the mouth breathing? So my first step for a 3-year-old might be to go see an ENT for an evaluation. If they have large tonsils and adenoids and that's why they're mouth breathing, then what we can do is take out the tonsils and adenoids or help them with allergies and figure out what's causing that inflammation and actually take out the obstruction if it's severe enough. I think if the tonsils and adenoids aren't that large, then maybe there's some more natural things you can try with allergies and that kind of thing. Even acupuncture can help with allergies quite a bit. So in that case, it's not going to be myofunctional therapy, but my role can be to guide people to the right practitioners. Now, the other thing that I really recommend is finding an early intervention orthodontist. So if I see a 4 or 5-year-old who's mouth breathing or tongue-tied, it might not be a good time to have a tongue-tie surgery. It might not be a good time to do an in-depth myofunctional therapy program, but it might be a good time to connect them with an orthodontist who can start guiding that growth and treating their jaws and helping the structures from a really early age. Now with a 4 or 5-year-old, that's an age where you can teach them really simple exercises, and that's what I do all the time. But I'm not going to put them into an in-depth program. I might do 2 or 3 sessions and then take a break for 6 months to a year. I give the parents as many tools and techniques and things to do on their own as I can, and then I guide them to the orthodontist and the ENT and the other specialists, and that might be all that I do. So the mini myo program is very individualized and very specific to the age of the kid, the situation and the symptoms, and the family dynamics. It's really going to come down to how much does that parent, how much are they able to, and how much do they want to put into exercises with their kid, watching for nasal breathing versus mouth breathing, and all that kind of thing. So we can treat kids that are under the age of 5. It's just different than how we treat the adults who are over a certain age, and even older kids like 7, 8, 9-year-olds. They are totally different when it comes to their ability to do myofunctional therapy exercises than a 3, 4, 5-year-old might be. Plus, it does depend on the kid's maturity, and it can depend on if the child who's 4, for example, I can think of a couple families I have like this. If a 4-year-old has a big brother and big sister who are doing real myofunctional therapy exercises, that 4-year-old will do amazingly well because they're really trying to look up to the big brother and big sister or mom and dad. If it's just a 4-year-old I'm working with on their own, chances are they're going to struggle a bit more. They're not trying to achieve to be just as good as their older siblings. So those are kind of the dynamics that would go into treating kids under age 5 for myofunctional therapy. I hope that helps. I hope it makes sense. Please post questions and ask anything you want below, and I'll be making more videos like this for you guys in the future.